certainly American.
Good afternoon. It is 1:33 and we start on time. So it is wonderful to see you all and welcome to the Health and Government Operations Committee. Today is March the 19th, 2024, and we're going to start bill hearings with our wonderful senators. It's so great to see you. So I am going to call you as I see you. I saw first Senator Kagan. We have Senate Bill 649, the 911 Trust Fund Purposes Training in Telecommunications Cardiopulmonary Resuscitation. That will be the first one. And just a rule, if your bill is identical to the House bill, just say it's identical and hello, and we will not waste your time. We will be very grateful. And then after that, it will be Senator McCray. Nice to see you all. So good afternoon, Senator. How are you?
Good afternoon, Madam Chair, Madam Vice Chair, colleagues. For the record, Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville, with two bills that have passed unanimously in the House and in the Senate. The first, as you said, is the telephone CPR bill. And that will enable there to be from the 911 fund, quarterly training in CPR. The pilot program in Charles County doubled the number of lives saved. Happy to take any questions.
Are there any questions for the wonderful senator? And I understand Senator King was here, so we're going to give her extra points because she was first and I didn't see her. There are no questions, Senator. You also have Senate Bill 459. Let us know if it's in the same posture.
I do. Once again, for the record, Cheryl Kagan, still very proud to be the senator for Gaithersburg and Rockville. The Mega Council is the Maryland Efficient Grants Application Process. It also passed unanimously in the Senate and the House, and this helps work towards how the state of Maryland can work better with our nonprofit organizations, working toward a common application, a common app, the same way colleges do, between COVID and a lot of other demands. We just needed an extension. They want to continue their work, and the comptroller wanted to be added. We're also looking at an ombudsman. Happy to take any questions, Madam Chair.
Any questions for the senator? Seeing none, Senator, thank you for presenting your bills. It is such a pleasure to see you.
Always. Thank you all. Good
and
luck.
This actually concludes the bill hearings on Senate Bill 649 and Senate Bill 459. Next, we have Senator King, who was here first, Senate Bill 375, State Contracts Prohibited Prohibitions. Senator King, I apologize, and you get extra points for that.
Extra points. Good. Nice to be here. Nice to see you all. I haven't been over here in a while. Senate Bill 375 is an exact cross file to HB 289.
Wonderful. We love it. Thank you so much. We hope you have a blessed day.
You too. Thank you.
This concludes the bill hearing on Senate Bill 375. And then we have the amazing Senator McCray, which is Senate Bill 341. Good afternoon, Senator. How are you?
It's good to see you. And I love the excitement and the vibrations coming from the HGO committee. Madam Chair, I'll also be brief too. Senate Bill 341 is a direct cross file of House Bill 390, and just great to be able to sit with you all.
Well, thank you for coming to see us. We really appreciate to see you in person. All right. Have a blessed day.
Have a blessed day.
This actually concludes the bill hearing on Senate Bill 341. Are there any senators sitting? Anyone representing any senators? Okay, why don't you come forward, please, and tell us your name, who you're representing, and the bill number, and if it's in the same posture. Okay.
Thank you, Madam Chair. For the record, my name is Sam Deschanel. I'm here on behalf of Senator Klausmeyer to present Senate Bill 996. It is a cross file in the identical posture to House Bill 759. And I can answer any questions that you all have.
All right, wonderful. Well, thank you so much. Are there any questions? Seeing none, thank you very much. Give our love to the senator. This actually concludes the bill hearing on Senate Bill 996. Are there any senators here or anyone representing any senators? All right, let's move on. Is there someone here for Senate Bill 210? Will you be so kind and come up, please? Tell us your name. This is the Emergency Medical Services Paramedics Immunization Administration effective date. All right.
I think my cue is to be brief, yes?
Yes.
Good afternoon, Madam Chair and members of the committee. I'm Dr. Ted Delbridge, Executive Director of MEMS, the Maryland Institute for Emergency Medical Services Systems. And
Not so fast. You can take your time.
okay, Senate Bill 210. Prior to the COVID pandemic, EMS paramedics were authorized in statute to administer hepatitis and seasonal influenza vaccines to other public safety personnel only and within their own jurisdictions. During the COVID pandemic, the executive order and subsequent legislation that was extended to the public under strict guidelines. We seek to extend that option beyond its current sunset date of January 1st, 2025. To date, tens of thousands of COVID and influenza vaccines have been safely administered by EMS personnel. At least 34 other states authorize their EMS clinicians to do similar work. It's noteworthy that only 1/3 of Marylanders receive influenza vaccine each year. And that's problematic when hospital emergency departments are nearly overwhelmed as they've been this year with patients with potentially avoidable respiratory viruses. Leads to prolonged waiting times, delays in receiving new patients arriving by EMS, and on many days, more than 600 patients boarding in hospital emergency departments because of no available hospital beds for them to be admitted to. We should consider this a situation that is for all hands on deck, including EMS public health people. Vaccines are only offered under strict guidelines, not during 911 encounters. They occur during special events and mobile integrated health prearranged encounters. They're only authorized by physicians, and they're provided only when coordinated with local health departments, a hospital or a hospital system. It's only appropriate to make this option available to EMS jurisdictions for the benefit of their communities, and we urge a favorable report for Senate Bill 210. Thanks.
So for the committees, when you start and you look at Senate Bill 210 to Senate Bill 255, those were not crossed, okay? The other ones are all identical. Are there any questions for this witness on Senate Bill 210? Okay, did anyone oppose this bill in the Senate?
No.
Okay, all right. Thank you so much for presenting. Is there anyone here for Senate Bill 210 that is in opposition? Yeah, you would like to be heard? You're supporting the bill.
Madam Chair, not in opposition, in support of the bill.
Why don't you go ahead, give us your name?
Thank you, Madam Chairman, Vice Chair, and elected officials. Good afternoon. My name is Dr. Matthew Levy. I'm the EMS Medical Director and Chief Medical Officer for Public Safety in Howard County. It is my pleasure to stand before you today to offer my enthusiastic support for Senate Bill 210. As my colleague and mentor, Dr. Delbridge, had mentioned a moment ago, this bill really empowers Maryland's frontline responders and public health officials to work collaboratively to meet the unmet needs of Marylanders, particularly those most vulnerable, the homebound, those with access to mobility issues, to help ensure vaccination and immunization services can continue to be provided. It is my, like I said, I fully support this bill, as does the administration of Howard County. Thank you for your time. Happy to answer any questions.
And thank you for being here with us. Are there any questions for this witness on Senate Bill 210? Seeing none, thank you very much. I hope you have a blessed day. This concludes the bill hearing on Senate Bill 210. We're going to go to Senator Lamb, who I saw next, and he has two bills here, actually one bill, and that is Senate Bill 50, Human Relations Commission on Civil Rights Appeal on Final Orders. And for the senators that are here, if your bill is identical to ours, just let us know. That's all you have to do. Good afternoon, Senator.
Good afternoon. How are you?
I'm doing great. And you?
Good. Good afternoon to members of the committee. Happy to be here. Senator Clarence Lamb, District 12. I'm here to present Senate Bill 50, Human Relations Commission on Civil Rights Appeal to Final Orders. This is a bill that is identical to House Bill 394, which passed the House unanimously, and is really just ensuring that Marylanders have an option to address discrimination complaints that come before the Maryland Commission on Civil Rights.
Thank you, Senator. Are there any questions for the senator? Seeing none, Senator, thank you for being with us today. You have a great day.
You too.
This concludes the bill hearing on Senate Bill 50. What, any other senators? Who is here? Okay. Okay, Senator McKay. Oh, who was first? Quarterman was first. Okay. Senator McKay, how are you? Great to see you. And you have Senate Bill 558, Garrett County Procurement Bids and Contracts.
I do.
Is it identical to the House?
Identical to House Bill 907 passed unanimously, ma'am, on the House floor.
That is wonderful. So any questions? Seeing none, this concludes the bill hearing on Senate Bill 558. Senate Bill 370. Actually, you have, I think that's it, right? Yeah. Wonderful to see you. You have a great day, Senator. Thank you, Senator Quarterman. Senate Bill 573, how are you? Good, thanks for asking. General provision, stay flat casket of an eligible decedent. Very good bill, and you had a great person that crossed the bill too.
Thank you. I appreciate that. I believe you guys are very familiar with that.
Yes, we are. Is it in
Excellent.
the same posture?
Same posture, pass unanimous.
Wonderful. Are there any questions for the great senator? Seeing none, Senator, thank
Thank
you
you.
for coming. You have a blessed
Take care.
day. Concludes the bill hearing on Senate Bill 573. Is there anyone here that is representing any of the senators that would like to testify? Will you please come forward? One at a time, tell me who the senator is and the bill number. That would be great. And your name. What's the bill number, please?
Senate Bill 183.
Senator Bailey.
Yes, ma'am.
All right, and this is Senate Bill 183, Senator Bailey, State Procurement Prompt Payment of Suppliers. How are you? Give us your name, please.
I am good. I'm Christina Vigorito and I'm Senator Bailey's Chief of Staff.
How are you?
I'm good. How are you?
Good. So is it in the same posture?
Yes, ma'am, it is.
All right, do you have any questions for her?
We
All
had a
right.
fabulous cross file.
Okay, beautiful. And you know, we loved your father-in-law here.
I know. You'll get
He-
to see me soon again, I'm sure, for another
He
bill.
was such a beautiful man. Anyway, one of my mentors. It's great to see you and I hope you have a blessed day. This concludes the bill hearing on Senate Bill 183. Thank you. You're welcome. Next, please. What is the Senate bill number? Senate Bill 374, Senator Stryker, State Emergency Medical Services Board Licenses and Certificates Application Requirement. Good afternoon, and what is your name?
Good afternoon. My name is Kara Dudley and I'm Senator Waldstreicher's Chief of Staff.
It is wonderful to see you. And tell me, is this bill in the same posture?
Yes, it is.
All right, wonderful. Are there any questions regarding this bill? Seeing none, thank you so much.
Thank you.
Let him know you did an amazing job. All right, and we have Senator Giles, Senate Bill 411. Good afternoon. How are you? Good, great to see you here. So this is Senate Bill 411, Department of Veteran Affairs renaming and Deputy Secretary of Military Family Policy and Programs.
Correct.
Is this in the same posture, Senator?
Yes, it is, Madam Chair.
Wonderful. Are there any questions for the senator? Seeing none, Senator, thank you so much for coming to see us.
Thank you. Actually, I have another bill here today too. if you-
Yes,
Is it okay?
go ahead.
All right, it's Senate Bill 88. It's also in the same posture as the House Cross File HB 55.
And Senate Bill 88 is actually the Maryland Commission on Veterans and Military Families. Same posture. Any questions? Seeing none, thank you, Senator.
Thank
We
you so much,
appreciate
Madam Chair.
seeing you.
Good to see you.
Have a blessed day. This concludes the bill hearings on Senate Bill 411 and Senate Bill 88. Any other senators here that need, or anyone representing a senator? Seeing none, let's go back to the regular agenda. Senate Bill 224. Anyone here for that bill? How are you? I'm doing great. This is actually cemeteries, burial transit permits require information. All right.
Yes, ma'am. I am, good afternoon. My name is Commissioner John Dove.
Yes.
I'm the Commissioner for Occupational Professional Licensing at Department of Labor. Online with me is Executive Director Debbie Rapazzo. She's here just to answer questions. She's our Director of Cemetery Oversight. I'd like to thank Chair Pena Melnick and the rest of the committee for having us. This bill would make it easier for family members to locate the final disposition of cremated loved ones. Currently, an ancestor's burial location is listed on the death certificate, typically identifying the cemetery the loved one is buried in. However, if the loved one was cremated, the final disposition listed on their death certificate is most likely the name of the crematory, which in most cases is not where the remains are placed. This bill will add an explanation on all death certificates, listing final dispositions of cremated human remains by stating who received the remains and their relationship to the cremated person. This would provide family members the additional information necessary to assist them with locating a loved one's remains. It's a small change, but an enormous help to a descendant having the heartbreaking experience of looking for an ancestor's final resting place. Passing SB 224 could prevent or ease some of that heartbreak and give these families peace. Thank you for your time, and we ask for favorable consideration.
Tell me something. Thank you for being here. We appreciate it. Was there any opposition in the Senate?
No, ma'am.
All right. Are there any questions Vice Chair Collison.
Thank you, Madam Chair. Just to clarify, what would go on, I'm just affirming, is the name of the person who received the remains.
Yes,
There's no location or anything, just the person's name.
correct.
Thank you very much.
Any further questions? Seeing none, I want to thank you both. And Ms. Debbie Rapazzo, thank you for your testimony. It was great. You have a blessed day, okay? Anyone
Thank
here
you,
for this bill? Seeing none, this concludes the bill hearing on the Senate Bill 222. Anyone here for Senate Bill 236? Will you be so kind and come up, please?
No, that was 224.
No, that was 220, the one that I just ended was 224. So this is Senate Bill 2. What bill are you here? Let's just do 236. It's okay. You're here already. All right, let's do them. And let's do one at a time. 236, State Acupuncture Board Sunset Extension. Give us your name and the testimony. And when you're done, I'd like to know if anyone opposed the bill as well, okay?
Understood. My name is Sarah Case Heron. I'm the Director of Governmental Affairs for the Maryland Department of Health. We're respectfully requesting a favorable report on this bill, which is part of the department taking a uniform approach to recommended sunset extensions for our independent health occupations boards. We believe that the extension period through June 30th, 2028 will give us the time needed to assess ongoing concerns related to licensure, technology, and administrative functions. And we believe that a 3-year sunset extension allows ample time for the department and the boards to examine these functions and return it to the General Assembly. All of the testimony in the Senate was favorable.
Okay. And may I ask you, why is a sunset, why is it 3 years? They're usually longer.
We want to take this time to review some concerns, particularly related to licensure and technology, to ensure that we can get accurate data on workforce and other issues. And we believe that the 3-year time period, which we're recommending across the board, so to speak, for our independent boards, will allow us that time for review.
Okay. And no one opposed the bill in the Senate?
No.
Okay, any questions? Seeing none, thank you very much. This actually concludes the bill hearing on Senate Bill 236. Which one would you like to do next?
We could go in order. Senate Bill 239.
239, State Board of Occupational Therapy Practice Sunset Extension. Go ahead, your name again?
Sarah Case Heron from the Maryland Department of Health. And once again, we are recommending a 3-year extension, and this is again to allow us to do a thorough evaluation of the boards across the board, so to speak. This one, there was in the Senate one testimony that was favorable with amendment. The bill was not amended.
And what was that amendment?
Oh, I do not have it at my fingertips, but I can get back to you with that.
Okay. Yeah, what is it?
Amendment was to go to 2035 instead of 2028.
Okay.
Yeah.
All right. Any other questions? Thank you, Delegate Hill. I appreciate you. All right, seeing none, this actually concludes the bill hearing on Senate Bill 239. Senate Bill 257, State Board of Physical Therapy Examiner Sunset Extension. Your name again?
Sarah Case Heron.
You have not changed.
No, not changed. For the Maryland Department of Health. And once again, we are recommending an extension to 2028, as with our other independent boards, to allow us to do an evaluation of ongoing concerns related to licensure, technology, and administrative functions.
Any opposition in the Senate?
No.
Okay, any amendment proposed?
None for this.
All right, any questions for this witness? Seeing, oh, yes, Delegate Hill.
So I understand you say you're trying to do it uniform. And the chair asked about why are you shortening from 5? And on the first one, the acupuncturist, you said, well, there are some technical things that we need to go over. So you're in three years from now, you're going to be reviewing all of these boards have the same issues. Is the plan to then go back to 5 or 10 year sunsets, or is this the new plan to always be doing it every 3 years?
My understanding is the plan is to do a uniform look and then determine whether or not there needs to be, there can be a more extended period of time. But we are doing the look across the board, and it is the same technology and licensure issues we've been seeing in a number of places. So we're trying to take a uniform approach for review.
Okay, if I may.
Absolutely.
So I understand that we're looking at them at the same time. Maybe I don't have clarity of what happens. I mean, to me, that's a 3-year window, and the goal at the sunset is you're going to look again and see if we've achieved the goals, as opposed to we know we've achieved them and we can go a little further. The sunset's
I think it'll depend on what the review finds. So if we've done the review and found that we've achieved the goals, then we could potentially have a longer time period. Otherwise, we might need to look and see if there's additional review needed.
All right, thank you.
Thank you, Delegate Hill, for your questions. Any other questions or concerns? Yes, Delegate Kaiser.
Thank you, Madam Chair. I was so
You're
excited
welcome.
you were going so fast, but I had a moment to think while Delegate Hill was asking a question. I hear that in doing these 3 bills and each with a 3-year extension and looking for some uniformity, I guess my only question is workload. Is there an argument to stagger them? And presumably there are other boards, and maybe not under your purview, that, I mean, what's the overall plan and why should they all happen at the same time?
I believe that the effort here is to have uniformity so that we're taking a comprehensive look at our workforce across the board. Part of this is because we're seeing a lot of concerns about technology and an effort to be able to get, as we grapple with potential workforce issues in the state, have an understanding of where our workforce is across the board. And so that's part of the effort to do this review comprehensively and with each of the boards together.
Okay. So the boards are not going to be terminated, and you're able to do the review anyway. So why the internal deadline? Make me understand it.
I believe, and the logic here really is to make it, to have a comprehensive review so that we can look at everything all together and evaluate some of the concerns that we're seeing. Some of which have been involved with particular boards, but some of which are across the board. And so that we can have this fuller picture of our workforce look. And we believe that the 3-year time period will give us the time that we need to look into any potential issues and to shore up our technology. And as we move toward a sunset, and give us the ability to return to the General Assembly in 2026 with an update.
Will you be opposed to a 5-year sunset?
I would have to bring that back. And
All right,
get
can
back
you
to
let
on
me
that.
know, please?
Yeah.
Thank you. Any other questions or concerns? Seeing none, Delegate Hill?
Strength about it, but since we have this moment to get it clear, I guess the problem I'm having, and I think it was echoed in the other questions, is you guys can review at any time. The sunset date doesn't tell you you can't look at them. You're presumably looking at them now. The sunset date is when they will disappear unless you ask, so this, once we know within 3 years, we want to be able to come back and ask for a bigger budget because we'll have a better understanding. I mean, what is the magic at 3 years that if you find problems and you need to fix it, I don't think you want to come back in 3 years. You want to have a little longer. That it's almost as if you can't do anything unless you squeeze it down. And that's what I'm really confused about, because the review that you're doing is not dependent on the sunset date. The sunset date sets an artificial deadline for when you come back to us, right?
I believe our goal here is to utilize this review, return to the General Assembly in 2026 with an update, but give ourselves the time to evaluate, but also allow us to have not come back earlier than that, but give us time to look at if there are any issues and things like that that need to be reported out. The 3-year number I know was looked at across the board to give us a chance to kind of do that review, but I can go back to get additional details on this.
If I understand correctly, what you're saying is you didn't want it shorter than 3 year. And what we're asking is, why isn't it longer than 3 years? So I think you've been answering a different question.
Understood.
Okay. Okay, thank you.
Thank you.
Yeah. So, yeah, if you can look into that, because not all the boards are sunsetting either. You're gonna have different review times as well. So there have to be some consistency. If you can look at that, that would be great, okay? And get back to us. And for someone who just testified for the first time like 2 months ago, you're doing quite well.
Yeah.
I have to say. All right, very, very proud of you. Anything else? All right, so this actually concludes the bill hearing on Senate Bill 257. You have a blessed day. Anyone here for Senate Bill 252? Will you please come up, give us your name? Oh, you know what? I skipped 222. Is there someone here for Senate Bill to come up? Come on. Yeah, calm down. And this is a State Board of Environmental Health Specialist, quorum, examination, and apprenticeship. How are you? Nice to see you. I don't think I seen you once testified this session. Am I right?
It has been a while.
Great to see
Chair
you.
Pena-Melnick,
Great to see
Vice Chair Carlson, thank you so much. For the record, I'm Dr. Clifford Mitchell, Director of Environmental Health at the Maryland Department of Health. It's a pleasure to be here with you today to speak in favor of Senate Bill 222, which makes changes in the statute for environmental health specialists. I will not take a lot of time. I will simply say I appreciate the chair's and the committee's historic support for environmental health specialists in the state and the attention they've given to this often overlooked workforce. This would allow us and the board to create a pipeline. It will bolster some of our ability to find and license people in the state, and it will allow us to establish an apprenticeship program, which we are working on in collaboration with Morgan State University. So I appreciate everything the committee has done over the years for this profession, and there was no opposition in the Senate, and I'm done.
You were listening. All right, are there any questions for this witness? Clifford, it's always great to see you. All right.
Thank you, Chair.
We have a virtual witness on this bill. You see someone virtually? Yeah, will you bring?
I'm sorry.
Okay, okay, thank you. So this actually concludes the Senate bill hearing on Senate Bill 222. Let's go now to Senate Bill 252. Is there someone here for that bill? How about 255? 252 is virtual, so let's do it. And that is Public Safety 911 Trust Fund alterations. Good afternoon, how are you?
Good afternoon, Chair, Committee. Thank you for having me here for today. I apologize I can't be there in person. I am clearly in a hotel room, so not present in Annapolis today. This is one of two departmental bills in front of your committee today. And our goal here is really to codify.
Give me 1 second, I apologize.
Oh, sure.
White Holland, do you want to go see about your friends, make sure they don't leave? Thank you. Yeah, go ahead, go ahead. I'm sorry, I apologize. You can
No
continue.
problem. So this is one of two bills that you have in front of you today that are departmental bills from the Department of Emergency Management. I am Anna Sierra. I'm the Chief Legislative Officer for the department. And this bill will codify existing practice in our 911 centers and with our county governments. Over the last several years, Senator Kagan, through her leadership, and Delegate Hill, who is on the committee, through her leadership, made several changes to the 911 statute. And in the course of those changes, there's been a little bit of language funkiness that has happened that has created a little bit of lack of clarity for county governments on how they use their county portion of the 911 fee. The 911 fee has traditionally been used, the county portion, to support general public safety answering point or 911 center operations, including salaries for staff. But there's also a state portion of the fund that has not traditionally been allowed to be used for salaries for staff at the local level. That state fund is used for a very specific set of eligible criteria. You heard a bill earlier today adding to that eligible criteria. So our goal here is to clean up the language to ensure that local governments are comfortable in using their county fee to support county PSAP personnel. This was brought to our attention by a county last year that their legal counsel had raised some concerns about the clarity of the language. So this will simply clear up and codify existing practice.
Was there anyone in opposition in the Senate?
No, ma'am.
Are there any questions for this witness, Senator Hill? I mean, Delegate Hill.
Thank you. Thanks for being here and for all the work. You know, we have another bill that's been moving that was to allow the funds to be used for teaching CPR. That's not included in this? Do we need these to be two separate bills?
Yes, so this is clearing up the county fee portion of the state trust fund. The bill that you just heard from Senator Kagan and that you of course co-sponsored that Delegate Helen White, co-sponsored would allow a different eligible fee under the state fund. So it's two different portions of the trust fund that we're adjusting today.
Thank you.
Yes, ma'am.
Thank you for the question. Any other questions or concerns? All right, thank you so much for being with us today. We really appreciate it. This concludes. Are there any other witnesses? No, okay. This concludes the bill hearing on Senate Bill 252. We have Senate Bill 255. I believe you're it as well. It is Public Safety Volunteer Company Assistance Fund alterations. Tell us your name again for Senate Bill 255.
Yes, ma'am. I am Anna Sierra. I'm the Chief Legislative Officer for the Department of Emergency Management. And again, this is another technical cleanup bill. This is a departmental requesting the official transition of the Voluntary Company Assistance Fund over to MDEM. We have administered this fund for over a decade, longer, in fact, but we did that as part of the military department. So the military department is where MDEM used to sit. Those of you familiar with MEMA, we were MEMA up until October 2021. When we moved out of the military department and became our own department, we missed this section of statute to transition over to MDEM. So right now we're operating under a memorandum of understanding with the military department so that we can continue to administer this program. We have the staff under our budget, and we also have the fund under our budget. So this is just a legislative cleanup. There was no opposition in the Senate.
Thank you very much. Are there any questions for this bill, on this bill? Seeing none, thank you for being with us. We really appreciate it, okay? I hope you're in a fun city, at least.
Washington, D.C.
Oh, okay, good. Enjoy it.
Thank you.
This actually concludes the bill hearing on Senate Bill 255. Next, we have Senate Bill 253. And thank you for being so patient. You waited there. And this is Department of Natural Resources Pay for Success Contract Procurement Exemption. Is it in the same posture?
Yes, thank you, Madam Chair. This bill passed, the cross-file passed.
Give us your name.
Dylan Baylor with the Department of Natural Resources. This is a cross-file of a departmental that this committee in the House passed unanimously. It provides a targeted procurement exemption for pay for success contracts.
Any questions? Seeing none, thank you for being so patient. I hope you have a blessed day.
Thank you, Madam Chair.
This actually concludes the bill hearings for today, and we have some special guests, and I would like Delegate White Holland to introduce them.
Thank you, Madam Chair. I am so very pleased to have two visitors here.
May we have them come up, please?
Yes, please come on up. We have Mac and Maddox, who are here, were dismissed early from school and decided to stop by the State House today to see democracy in action.
They can sit.
They can sit
right here.
Sit at the table.
Yeah.
Yeah.
Can you put the mic?
Don't touch the mic.
Okay. Okay, who would like to go first? Can you give us your name?
My name is Mac.
Okay, Mac, nice to see you. And what is your name?
Maddox.
Maddox, all right. And tell us, what school do you attend?
Windsor Farm Elementary.
All right, and what grade?
I'm in fourth grade. And I'm in kindergarten.
Oh, wow. So tell us, the most important question here is, what is your favorite subject in school?
Mine is science.
Oh, very nice. That's very appropriate for this committee, the health committee. And what is yours?
Recess and lunch.
Okay. All right. So I would say, go ahead. And who's with you today? Who's the lady sitting behind you? You want to give us your name? Well, it was great to So what is your relationship? Mom, is it mom or?
No.
Huh?
Yeah.
Oh, okay. Well, it is wonderful to see you both and thank you for your great testimony and your bills will be approved. You have a blessed day, okay? Anyway, this concludes the bill hearings and welcome to the HGO committee anytime. Could you take us down, please?